I'm Allie Cook for the Dental News Network. Today is May 16th, 2012, and this is your Wednesday Watch. Here are today's top stories brought to you by Schick Technologies. The ADA has responded to a recent story in the New York Times. The Times reported that emergency room doctors are having trouble differentiating between patients coming in with legitimate dental problems and those who are just trying to procure prescription painkillers. The ADA has insisted that the Times failed to address the underlying issue, which is the fact that there is, quote, virtually no consistent substantive dental safety net for low-income adults. The ADA went on to say that this story just points out the problems the United States has in providing proper dental care for those who can't afford regular visits to the dentist. The May issue of Dentistry Today, like all of our issues, provides you an opportunity to earn continuing education credits. This month's CE article deals with pH buffering and dissolved carbon dioxide with regards to dental anesthetics. We caught up with Dr. Stanley Malamed's co-author, Dr. Mick Falkel. Dr. Falkel, over to you.
Great, thanks, Allie. Really appreciate the opportunity. I want to thank Dentistry Today for allowing us to submit this article. It's been a true honor to work with Dr. Stanley Malamed on this, bringing an article, a CE article actually, on the advancements in local anesthetic, particularly around pH buffering, as well as what carbon dioxide in solution has to offer us in dentistry, which we haven't had before. So this is a great new science for you to understand and learn, and I think this article will bring you right up to speed. So if you have a chance, go to Dentistry Today, the May issue. It's a great article. It's 2 CE credits, and I hope you enjoy it. Thanks very much.
Thanks, Dr. Falkel. Up next, products and procedures. But first, here is a message from our sponsor.
Untether your imaging and unleash your potential with Schick Wi-Fi, an innovative new option for the Schick modular platform. Schick Wi-Fi eliminates sensor-to-computer cables, giving you freedom to move around patients and between operatories. Available exclusively through Patterson Dental.
And now, products and procedures. Doctor and lecturer Vicki Peterson has urged the general public and their dentists to pay close attention to white spots on teeth that may be indicative of celiac disease. She has stated that nearly 90% of those who suffer celiac disease have tooth enamel defects, such as white spots, discoloration, grooves, and undersized teeth. While these tooth flaws may of course be the result of more common causes, such as issues with fluoride or early childhood illnesses, Dr. Peterson has urged dental professionals to become acquainted with the signs of celiac disease. Here on the Wednesday Watch, we recently gave you an update on the Michigan State Dental Association's comments on the use of Botox and dermal fillers in the dental practice. We are now joined by Dr. Malcmacher, president of the American Academy of Facial Aesthetics.
Thanks, Allie. As president of the American Academy of Facial Aesthetics, I can tell you that I've worked personally with many of the state dental boards on the issue of Botox and dermal fillers in dentistry. What people really have to understand is that these are pharmaceuticals that are used just like local anesthetic for dental aesthetic and dental therapeutic purposes in the oral and maxillofacial areas. And, they're not just procedures on their own. And with training, with really proper training, dentists, just like they learned once upon a time to use local anesthetic, can use Botox and dermal fillers in, by learning the anatomy, physiology, pharmacology, and adverse reactions and how to handle complications. It's just like anything else that they use in dentistry. So don't get keyed in so much on the fact that, dentists are using Botox and dermal fillers. The question is, what are they using them for? And as long as they are using them for dental purposes, and there are lots of dental purposes ranging from gummy smile, ranging from proper lip smile lines and phonetics and aesthetics and all those different things, all we're talking about is dealing with all the soft tissue around the mouth, which is exactly the area that we treat and inject every day, to go ahead and deal with the hard tissue aesthetics that we do in the mouth. So Botox and dermal fillers in dentistry, they've been around for quite a few years at this point in time. Many, if most of the states allow it already for dental aesthetic and dental therapeutic purposes, and it's taught at over 50 continuing education venues across the United States and really around the world. So Botox and dermal fillers in dentistry, yes, it is really here to stay.
Thanks, Dr. Malcmacher, and thank you for checking out the Wednesday Watch. We'll see you next week with more from Dentistry Today and DNN.